Hello, everyone. I am at the office again today. Just did another real fun video about water. Actually, we tested about 15 different kinds of commercial waters to see which ones were most alkaline, most acidic. And it's interesting. So let me give you a little snippet on what I was talking about. Water has some things. Water is really important for us. First of all, water, I like to think of as kind of like the UPS truck, and it's bringing all the things that your body and your cells need. So you first of all need to have water. That's a key piece, is you've got to have enough water to be able to bring the nutrients in. But the second thing is sometimes the water is carrying a lot already, and so it doesn't have room for a lot of those nutrients. What is it carrying? Well, the problem with water is it will carry bugs, right? So that's bacteria, viruses, parasites, fungus, those kinds of things. It'll also carry chemicals that we don't necessarily like chlorine, fluoride, solvents, pesticides, forever chemicals. It'll carry those as well. It will also carry minerals, which minerals we want, right? But people complain about, well, I have really hard water. Well, that's the mineral content in the water, and there might be higher mineral content in water that's coming from, say, like a well or a spring. You may have high mineral content. We need minerals. And what are those minerals for? What do we do? What are they used for in our body? Well, minerals are actually the things, they're kind of like the UPS guys. They take the things out of the truck and they move it to your porch. They move it into your cell and enable you to use it. So if you don't have minerals, you actually aren't able to do a lot of the cellular processes that are so important. You have to have minerals. So I talked a lot about, first of all, how do you filter your water in order to get the things you want, but not the things you don't want? And really, reverse osmosis is the only way that will completely clear everything out of your water. It's the only way to get everything gone. But reverse osmosis leaves very mineral deficient water. And that water is what's called hungry water. It will take minerals from you. So you have to remineralize after reverse osmosis. So a lot of people don't know this. We don't want to go too alkaline. We don't want to go too acidic. So I tested all these waters, 15 different waters, and I found some that were actually too alkaline. Why is that a problem? Why is alkalinity a problem with water? Because your gut is the one place in your body that you want to be acidic. And if you add alkaline water to your gut, what you're going to do is neutralize the acid in your gut, and you will not absorb nutrients properly. So you're going to really alter your digestion if you drink too much alkaline water, or water that is too alkaline. We don't want acidic water, because acidic water actually will pull minerals from your teeth, and it will dissolve your teeth and make them weaker. So we definitely don't want acidic water also either. We want right in the middle. I'd like it to be around 7. 7 is neutral, 7.5, slightly toward the alkaline side. So you'll have to watch for the YouTube video. It's coming out probably within the next couple of weeks on which waters that you get in the store are the ones that you want to be drinking. Really interesting information that we found out today. It was good. All right. I've seen a couple of questions coming through. Let's get started. Can you get a tooth pulled if you have had radiation? Conventional dentist says no. They say a root canal is needed. I don't want it. They won't pull the tooth. Okay, so let's talk about this. What does radiation do? Well, radiation can affect the jawbone and can make it so that it won't actually heal after the tooth is removed. So that's their worry, is that it's going to cause, it's called osteonecrosis. And it's basically your bone dying and not healing. They don't want to do that to you, and I wouldn't want to do that to you either. So the thing you're going to want to do is talk with an oral surgeon about this. So I would talk to an oral surgeon. I would not go to general dentist if you've had radiation. And a key part is also is, where is your radiation? Was your radiation here, or were you radiated elsewhere? That's a key portion as well. But you're going to want to go to an oral surgeon, and you're going to want to talk to them about that. There's other things you can do. You can add hyperbaric oxygen, which will help your body to heal. And there's things that they can do. There's protocols that they can do to help you through that healing process, so that you don't have to get the root canal. That's a hard place to be in. The other time that happens, or that's a concern, is when somebody's using something called Fosamax. There's a whole bunch of different ones. They are medications that you take for osteoporosis. And what they don't tell you often is that when you take those medications, it impacts the way your bone actually heals. So you're not able to heal after a tooth removal for years after taking those medications. And they don't realize that. You don't realize that oftentimes. So we do the same when that's happening, when you've taken those medications, which is why we tell people, do not start those medications. Let's talk about how we can build your bones, build your teeth, build all of that without having to use the medication. Because if you get to the bottom reason why you're losing minerals, And that's really what osteoporosis is. If you can get to the root cause of that and solve that, then you don't need to take a medication that alters the way your bone heals. So really kind of some important things to know there. Why do I recommend a copper tongue scraper instead of others? Well, copper is antimicrobial. So just the use of it itself is going to actually do cleaning action beyond just the scraping. It's actually going to kill bugs on your tongue as well. So it's antimicrobial, and it is very non-bioactive. Basically, it's not going to change your body in any way. It's just going to kill the bugs. So that's why I like it. It's cleanable and it kills bugs while you're scraping your tongue as well. You can use others though. If it's a tongue scraper or not, use any tongue scraper over no tongue scraper. But I just like the copper. How do you feel about an all-on-4 or all-on-6 treatment in place of traditional implants? Okay, so let's do a little explanation here. What even does all-on-4 or all-on-6 mean? It's those billboards you see. You know how you see those billboards driving down the freeway? At least where I am, there are on these billboards where they say, teeth in a day. I've never, this is the best decision I ever made. Those kinds of things. And I actually did this. This is my exclusive practice for 3 years. So I'm very, very familiar with these procedures. Let me talk about the benefits. So this is if you really have had a very significant degeneration with your teeth. You have many broken teeth, you have many missing teeth, you have many infected teeth, and things are just falling apart to the point where there is just no fixing them anymore. And so you're looking at having all your teeth removed, because it really is an all-on-4, all-on-6 is all your teeth, either top or bottom or both, are all removed. And so what they're doing is, instead of just putting an implant for every 1 or 2 teeth, they're putting 4 or 6 implants in and putting all teeth on that arch, all 14 teeth onto, sometimes they'll do 12, but 12 to 14 teeth on those 4 to 6 implants. The concept is fabulous, right? All right. So with, only 4 to 6 implants, I can replace all 14 teeth. This is awesome. The issue is a couple of things. And I didn't know to ask these questions when I was doing this. And I actually had a lot of failures. And that was the reason I stopped doing it, because I thought, I am not doing anybody any favors here. And I've since learned that typically this procedure is fraught with a lot of failure. And when it fails, you lose 1 or more of those implants. And once you lose 1 or more of those implants, now all of a sudden you lose the whole thing. Because remember, the whole thing's all hooked together. You put these implants in and then you connect this one whole piece and screw it into all of that. So if you lose 1 or 2 of those anchors, you're losing the whole thing. The whole thing's going away and you're starting all over again. And I was really frustrated. My patients were frustrated. And I thought, I'm not really helping them when I'm doing this. So the thing that I did never ask is, why did you get in that place to start with? Like, why are your teeth falling apart like this? Why have you lost so many? What's going on? Because if that's not addressed, well, guess what? An implant still requires bone health and gum health and your health to be able to stay in your head. Well, that's why I know now why some of these failed, because I didn't address why did they lose their teeth to begin with. And that needs to really be addressed to begin with. Otherwise, you're going to just lose implants as well. And then you're going to be out a lot of money, because these are $50,000, $75,000 procedures. These are not things to mess around with. You want to make sure that you're really doing this the right way and setting up your body right for healing. So that's the difference between an all-on-4 or all-on-6 versus a traditional implant. A traditional implant is just, you're going to put 1 or 2 implants in for every tooth. The advantage of that, I mean, if you really are at the place where you're removing all your teeth, the advantage of that is if one fails, just that one is affected. The rest is all just fine. And then you just replace that one. But again, step back and say, why did I get in this place in the first place? Why am I here to begin with? And sometimes people will come in and say, I'm just ready to have you take all my teeth out. And they're really nowhere near that. They mentally may be ready, but physically they're not. Their teeth are really not in that kind of poor shape. They just are kind of done with putting money into it. But I usually tell them, you know what, I'm going to tell you what an all-on-4 or all-on-6 means is, you're going to put a lot of money into it. You're going to think you're done, but you're not. You're going to be maintaining that for the rest of your life. And you may lose implants and you may be replacing them, which is very, very pricey. So you're really not done. So let's just fix where you're at right now, and let's figure out why you are where you are. And then let's move forward for the matter. And usually people are like, you're right. Because once you've taken all your teeth out, you don't chew the same again. You really have about 20% chewing efficiency. You're never going to chew the same again. So let's keep your teeth if we can. And that's what I try to do. Let's keep your teeth if we can. If we have to remove them, let's replace them with a dental implant. And I like ceramic, and it's only affecting one spot. Can you comment on xylitol study and heart disease? I can, actually. There is a lot of talk about the xylitol study. What they didn't tell you, first of all, are the methods that they used. And so I've dug quite a bit into this. Methods that they used, but also the amount that they're testing. So they are testing, in fact, I'm trying to remember, it was pretty astronomical. Um, I figured out how much xylitol was in my tooth powder, and I figured out that the levels they were testing in this xylitol test, saying that there were heart conditions because of xylitol. I figured out at the levels they were using to test how much tooth powder you would need to eat, not just brush your teeth with, because you spit the large majority of that out, how much you would actually need to eat. It was something like 13 bottles a day. You would need to actually just chug 13 bottles of tooth powder a day to get the same amount of xylitol as they were using to test in these studies on a daily level. So what the problem with this is that they're using information that's not applicable to what we're doing. We're never going to use that much xylitol ever. We're never going to use it in that degree, and you're going to spit the large majority of it out. So at the small microscopic levels of xylitol that we're using, the concern isn't there. If you want to use it for baked goods, if you're using it as a sugar replacement, so that's really what they were talking about, is in areas where they're using it like as a dietary sugar replacement. So instead of using white sugar as you're making your chocolate chip cookies, you're using xylitol instead. Well, when you're doing that, you're using half a cup. You're using large amounts. It is minuscule the amount that's in the tooth powder. So if you're using cups of xylitol every single day because you're using it to replace all sugars in all of your food, then you're going to potentially see the problems that they're talking about with heart problems. That is where you need to look at the information and say, what are they testing? How much are they testing? How does this apply to how I'm running my life? So do I recommend that you use xylitol as a sweetener? I do not. Do not use it in your baked goods. Do not use it as a substitute for other things. Erythritol, the same. They're finding some of these same issues with erythritol. We don't want to use these as a sugar substitute. Can they be used in small quantities? I don't use erythritol, but xylitol, can xylitol be used in small quantities in like a tooth care product? It can, because it's extremely small, and the benefits outweigh the risk with this because the benefits are enormous. Xylitol is actually really good at stopping tooth decay in its tracks. It's really great at that. So again, if you want to consume 13 bottles of tooth powder a day, you're going to be at risk. If you're not, there's no concern. Okay. Can you create a reel on not wanting alkaline water? Yes, I can create a reel on not wanting alkaline water. I will see if I can't do that today, actually. Because and I talk about this quite a bit, but it's really important, as you don't want to go. I just say this all the time. Don't go extreme. Either way, in any way, don't go extreme. Don't go too acidic. Don't go too alkaline. Let's just stay right here in the neutral area. How can I find a dentist like you in my area? We have a directory on our site. It's the website is livingwellwithdrmichelle.com. If you go on there, we have a dental directory. We're building that. We're getting more dentists on there all the time. There you go. There's the directory site. And we are all about helping you find somebody in your area. Is it worth replacing titanium implants not crowned yet for a ceramic implant? So the question is, what is the concern with titanium implant, right? So there's two concerns. Number one is titanium overload. And I had two patients that really showed me this. One patient had extreme pain after she had a titanium dental implant placed. I removed it, pain went away. We tried it again, pain was there, removed it, pain went away. Put a ceramic implant in, no pain. What was the difference? It was the metal. Her body it wasn't an allergy. Her body just had an overload of titanium. And there's so much titanium in our world, we don't realize. It's literally like the hard candy coating on Skittles and M&Ms. Did you know that's titanium? It's in cosmetics. It's in sunscreen. It's in paints. It's in the bags you get from Walmart. It's in everywhere. And so we just have too much in our bodies these days. The body rejects it. So that's one issue with titanium. The second issue with titanium is it conducts electricity. It's a metal and it conducts electricity. So what it does is it's conducting Wi-Fi signals, cellular signals, everything around you, heat. It's actually picking those up and it's heating up that metal, because anytime a frequency passes through a metal, this is what a microwave does, is it just passes a frequency through the food and it makes the molecules in that food move around faster until they heat up. Same thing happens when Wi-Fi cellular frequencies pass through the titanium dental implant. It heats those titanium molecules up. They start to do this, and they start to go move faster, and they start to heat up. If the titanium heats up too much, it literally melts the bone, holding it in place. And so we see a lot of titanium implants being lost years down the road. I have a titanium implant myself right here. Why? Because it was placed, 25 years ago, probably longer than that now. Actually, probably longer than that. So it was placed, 25 years ago, and we didn't have the option of ceramic then. Would I do ceramic? Absolutely, I would do ceramic. I did ceramic on my son that needed a whole, he'd lost his teeth in a baseball accident, and that's what we did, was all ceramic up top for him. If I had the choice, like if I had an implant in and I had the choice and it wasn't going to damage my bone, I would have a titanium one removed and ceramic placed. That's going to be your call. You're going to need to ask how much is going to be damaged by removing that titanium implant. Is that going to damage the bone even more? Is that going to cause more risk? You have to kind of weigh all those things here. I got a tooth pulled about 20 years ago and they damaged a nerve, lower left lip numb. What can I do? Unfortunately, 20 years ago, probably not a lot at this point. I wish I had some better answers for you, but there are a couple things you can try. So you can try red light laser therapy, low light, it's called LLLT, something, red light laser. Usui is a brand that I like. It's spelled so weird. USUIE is how I believe it's spelled, Usui. And you have just look like little flashlights, and they're red light laser, and you can put it all on that area of nerve distribution. Go back into here and all that area of nerve distribution and see if you can wake it up a little bit. The other thing you can do is add a lot of what are called omega-3s. So these are fatty acids. It is fats, and they're the kind that you find in fish oil, those kinds of things. If you take 6 grams of those a day, which is a lot, it will regenerate the nerve sheath, which is the conductive portion of the nerve, basically. At 20 years out, are you going to see improvement? I don't know. I think at a year out, I would be very hopeful for you. At 20 years out, maybe not. But try the red light. It certainly won't help, or certainly won't hurt, and hopefully it will help. What do we do? ALF on a 10-year-old mouth breather. So what is ALF going to do? ALF is going to expand the mouth. So my answer is I would do an expander, absolutely. What a 10-year-old mouth breather is doing is telling you they cannot get enough air. They are not breathing properly. They are not getting enough air. They're not breathing through their nose, which means it's altering their growth. It's altering their cognitive ability, their ability to focus, on and on and on and on and on. So absolutely, I would do an expander, something that can make more room in the mouth, especially on a 10-year-old, because they're so changeable still. They're just growing. Whether you use ALF or a Vivos Guide or Candid Orthodontics, there's a whole bunch of different versions you can do. The idea is you just want to expand. What do I recommend to take for someone with osteoporosis? Absolutely, great question. So what I recommend is minerals, but in the kind of minerals that you can absorb, and also the vitamins to go along with it. I'm not a huge supplement pusher, but these are a couple that I actually have on my website called our remineralization kit. It remineralizes not only your teeth, but your bones too. So it's vitamin D and D3, K2, and then minerals that are specific for bones. I would just do minerals and the vitamins that help them get in. That's what I would do, and that's what I do every single day. I've heard fluoride is really bad for us and our microbiome. Is that true? Well, fluoride is not good for us in many ways. The microbiome is one of the things, but honestly, it's one of the ones that I don't worry that much about. I worry a lot more about bone health. I worry a lot more about thyroid health. I worry a lot more about brain health with fluoride. And if you want to look up any of this, if you go on, it's called the IAOMT.org, IAOMT.org. On that website, they have a fluoride position paper. I mean, you can go do research on your own as well, but this will just save you a bunch of time. Go on there. They have a whole bunch of fluoride articles all together. Or what I just did is I went to PubMed just recently. I went to PubMed and I just typed in fluoride research 2024. I could not believe it. I found an article talking, and it proved that there was thyroid issues, low thyroid, higher incidences of low thyroid in areas that had higher fluoride. There was a study that showed neurodevelopmental changes or behavioral issues in children that the moms had more fluoride while they were pregnant. Like, this is all this year. This is all this 2024 new research about fluoride. It is coming out in droves. There really shouldn't be any question about fluoride anymore. There's no reason to use it because we have alternatives. Hydroxyapatite is the alternative. There is no reason to use fluoride ever again. We have something so much better. What would you recommend as a test on an 18-year-old young lady whose jaw clicks when wide open? All right, let's talk about what is clicking when a jaw is clicking. There's in the jaw joint itself, there's a ball, there's a socket, and there's a piece of cartilage that fits between the ball and the socket. That piece of cartilage sits on top of the ball kind of like a hat. And if you pay attention when you open your mouth, like this, open, closed, the ball, and you can even feel it, put your fingers here, you will feel that ball moves forward and then it goes back into the socket. This is like the only joint we have where the ball actually moves completely out of the socket and then back in. Because if you think about like a shoulder joint, it's a ball and socket, but when the ball comes out of that socket, that's a bad day. That's a shoulder dislocation. We, in essence, dislocate our jaw joints every single day, every single time we open. So that piece of cartilage is supposed to travel with the ball as it comes open and then comes back. That piece of cartilage should travel. Sometimes because of injury, sometimes because of sleeping issues, because of jaw issues, bite issues, that piece of cartilage actually comes off of the ball. Sometimes that ligament gets overstretched and it will. So if that piece of cartilage is forward of the ball, when you open all the way, you're coming and then you finally pop and that piece of cartilage finally pops back on top of the ball. Is this a problem? It may be in a 20-year-old. I think it's worth looking at. It's probably due to an injury. Most likely they fell when they were learning how to walk or on a bike or a trampoline and hit their chin like this, and it shoved the ball back and severed the backside of the ligament, at least partially. So that piece of cartilage is kind of loose. There's no ligament holding it in place anymore. The reason it could be a problem is because that piece of cartilage is a protector. It's insulating the ball from the socket. It should be between it so it's not bone to bone. Well, if that piece of cartilage is out here, as that ball is moving forward, it's not protected. It's bone to bone until it hits here. And then once it pops, it's back protected again, and then it slides back off again as it comes closed. So what we see down the road is bone on bone. We call it arthritis, thinking, oh, this is like a genetic thing. No. It's just simply physical. It's bone touching bone with no protection in between. It's going to wear that ball out as it comes in and out of that joint all day long. Every time you talk, you chew, it comes in and out. It rubs bone to bone, and that ball starts to flatten out, causes all sorts of issues. What do we see issue-wise? We see headaches, we see muscle pain, muscle tension. You can't open your jaw very much, but then it starts to move back into ears. You get ear ringing, tinnitus, dizziness, head, neck issues, shoulder pain, muscle issues, neck issues, all the way down because this joint is degenerating. So I would get a cone beam CT scan on that 20-year-old and see, or the 18-year-old, and find out what is really going on inside of that jaw joint. I have temporary front 4 teeth on a flipper and a CPAP. Dental hygienist said to take it out at night because it was affecting my gums and roof of my mouth. CBT scan, only way to see if bone is good. Okay, yes, CBCT scan is the way to see if bone is good. You can kind of see it. So basically your question is, you have your 4 front teeth, either here, either top or bottom, are on a removable retainer in essence, but you're also wearing a CPAP at night. Hygienist is saying this removable retainer is making your gums sore. You should take it out at night. Is this a problem? Yes, actually, I do recommend taking those retainers out at night because that acrylic against the tissue in your mouth, first of all, never has a chance to breathe. But second of all, that acrylic can harbor bugs and can be very allergenic itself. So here's what I would recommend. You take that retainer out at night, you put it in colloidal silver. So you just do like a cap full of colloidal silver in water and you're going to soak it in that. Why? Because you're going to kill the bugs that have then gone to live inside of that acrylic from your mouth. You're going to kill the bugs. It's going to help when you put it back in the next morning. So a cap full of colloidal silver in the water. Make sure it's colloidal, not ionic. Ionic will turn it kind of a bluish gray color. Colloidal silver. ASAP is my favorite brand. If you look on Amazon or anywhere, it's called ASAP. That's what you want. You're going to put that in the water. That's going to help. You are okay, especially if you've got a nasal CPAP, to wear it without that flipper in at night. So hopefully that's what is going to work for you. I use a Brita water filter. How can I test my water for the right pH? Okay, I didn't bring it in here with me, but you can get it. They're called reagent drops or pH testing drops. They're like $10 on Amazon. Just get some drops, test it, and see. That's going to test pH. Now, it's not going to test, are there still solvents or pesticides or those kinds of things in that water? With a Brita filter, that's a carbon filter, it's good, but there are still going to be some things in that water. It's not going to remove fluoride. It's not going to remove chlorine. I don't believe it removes chlorine. It might. Check me on that one. It's not going to remove fluoride for sure. It's not going to remove some of the bigger microbes. It's not going to get rid of those. So it's not completely, but it's better than nothing. And it does preserve the minerals. So I like it. Check your pH. Use those reagent drops. Is there a way to heal nighttime tooth grinding? Also, the best way to heal after cleaning out an implant that has an infection, hoping to minimize soft tissue recession. Okay, so those are 2 questions. Is there a way to heal nighttime tooth grinding? Yes, you have to say, why am I grinding? That's the first question. Why am I grinding my teeth? And the predominant answer is because I'm not getting enough air at night. We find that on a cone beam CT scan, or even better, we find that on a sleep study. Why? Because when your muscles relax at nighttime, when you go into deep sleep, muscles relax, or REM, actually, in REM sleep, you're totally paralyzed. When you get into these deeper levels of sleep, all of these muscles paralyze. When they paralyze, they can't keep this airway open anymore. And if it's not big enough, if there's too much stuff pushing its way back there, if the tongue is back there, if the jaw is back there, if all these things are back there and they relax and all of a sudden you can't breathe, your body says, nope, no can do. You're going to die unless you do something. So what do? You squeeze your teeth, you grind your teeth. Why? Because it engages all these muscles, holds them open again, and you get more air. Unfortunately, it also takes you out of deep sleep or REM sleep because you can't engage a muscle and stay in that level of deep sleep. So your sleep's poor, but your body's keeping you alive. So the grinding has everything to do with your airway. You got to get a cone beam CT scan and find out what's going on and how do you fix that. Also, is there best way to heal after cleaning out an implant? Absolutely. The thing you need to do is you need to grow bone. So that is that remineralizing kit I talked about on the website. It's going to be vitamin D3, vitamin K2, and tooth and bone formula. It is minerals to heal that area. Red light laser therapy is also very good for that. What is the best way to support sensitive teeth? Okay, so this is actually coming from all of you telling me which of my products help best with sensitivity, and this is what works. You're going to actually start doing the mouthwash first, and you're going to use that a couple times a day, and you're not going to just rinse and then spit. You're going to rinse and hold. What that's going to do is get it into all the nooks and crannies of the teeth. So you're going to start that for about a week. Then you're going to start the sensitive tooth powder, and you're going to brush with that twice a day. You're going to continue doing the mouthwash. The mouthwash is actually the thing that has helped very most everybody with sensitivity. So start doing that twice a day. You're going to notice a huge difference. Where do I find a dentist to do ceramic implants? Great question. You're going to ask them. So it's going to be an oral surgeon most likely, and you're going to ask, do you do zirconia? That's the word they're going to know, zirconia. They may know ceramic as well. It's basically two words for the same thing. Do you do zirconia dental implants? Is there a treatment to reduce the gagging effect with partial dentures in the upper back? All right, so partial denture that you're gagging on, two potential reasons. Number one, at the roof of the mouth, there's something called the hard palate. It's hard. That's what you feel. Feel it with your tongue. It's hard up there. And then you go further back and you feel it give away a little bit. That's what's called the soft palate. So there's the hard palate and then the soft palate. That partial denture should stop before the soft palate begins. If it doesn't, it's in your gag zone. So what they need to do is just trim back that partial denture so that it's short of that gag zone. That's number one. Second thing is, a lot of times if you're gagging that much, it's because you don't have enough room in your mouth for your tongue and for everything else to fit. This is an airway issue. It's all falling back and it's getting back into that soft tissue and it's making you gag. And if you add something into your mouth, your tongue has even less space now to operate. And so it has to fall back into your tongue or into your airway and it makes you gag. You probably have an airway issue along with this, but you can trim back that acrylic on the back side of the partial, get it forward of that soft palate line, and then the gagging should really improve. What would I recommend for a male in the 50s that only has teeth left in the front, top and bottom, that has crowns on all teeth? All right, so basically what you're saying is I got teeth here and I got nothing back here. I would 100% recommend dental implants if possible. Sometimes it's not, well, I'm going to couch that. It's always possible to try to regrow bone, but you may have lost a significant amount of bone because the teeth were gone for a long time. You may have to do some bone grafting to rebuild the areas. And then I would put 1 to 2 dental implants back there. If you put a dental implant here and another here, you can do a bridge. So you can actually get 3 teeth on each side with just 2 dental implants. That's what I would do if this were my mouth, for sure. You can also do something removable, but then we're dealing with some of the questions we've actually been talking about today, which is you have to make sure that you're cleaning this removable piece. You have to make sure that it's not going too far back and making you gag. You don't chew as well with it, but you're going to chew better than you're chewing now. But I will tell you, a lot of times people tell me that partial dentures fit better in their top drawer than they do in their mouth. What does that mean? It's kind of a joke. Basically, it means I don't ever wear it. It's too big of a bother. I'm chewing fine with this up here. So if you really want teeth and you want them to work and you really want to use them, I would do dental implants. Is there anything that I can do for my translucent teeth to help look like one solid color? Yes, you need to add more hydroxyapatite because it will make your teeth more white. It'll make them whiter and more opaque. So I would just do the remineralizing or the whitening tooth powder either. along with the mouthwash, and you're going to just strengthen this enamel and help them to not be as see-through. 15-year-old mouth breather with perfect arch and alignment and occlusion. Is expander still suitable? If they are mouth breathing, they do not have enough space. Period. So there, you absolutely need to have more space. It could be that it's simply a nasal deficiency, and so they can't get enough air through the nose, because if you close your mouth, you have to breathe through your nose. You don't have an option. Well, their nose may be too narrow, which means that they still need expansion. So an expander in the roof of the mouth will also expand the base of the nose. Here's a good way to test. Have them close their lips. Breathe through the nose. See if you can hear it. Like, you shouldn't be able to hear it. You just hear mine. We shouldn't be able to hear that much. Maybe you can't hear as much as I can. But then you go right here above the cheeks and you pull, and then you breathe. See how much quieter that is? What does that mean? I need more space here. I need more space in my nose. So a palatal expander will also expand the floor of the nose. Most likely, if you have a 15-year-old mouth breather, guaranteed they're not getting enough air. You have to do an expander. How do you treat an infection from a root canal? Shows on an x-ray, but otherwise no issues. That's always the situation, or 80, 90% of the situation. It shows on an x-ray, but otherwise no issues. No issues as far as pain here. But every single time you chew, you are sending that infection throughout your entire bloodstream. So I guarantee you there is an issue somewhere. It's affecting your heart. It's affecting your brain. It's affecting your blood flow. It's affecting your blood sugar regulation. It's affecting your hormones. It's affecting something, your lungs, your kidneys. It's affecting something somewhere down the road. So what do we do about it? We take the tooth out. Take the tooth out, clean it all up, and replace it with a dental implant. Or a removable, like we talked about, a removable partial denture can work too. You mentioned issues with large amounts of erythritol. When it comes to our 16-ounce drinks, do you know if companies generally use large or small amounts compared to baking? Should these drinks be limited? So I don't like erythritol or any of these sugar acids in any of my consumable foods. So I don't like them in drinks, and I don't like them in, not sugar acids, excuse me, sugar alcohols. I don't like them in food, and I don't like them in drinks. I don't like them in either one. Stevia is my preferred one for a drink. So if I'm going to have an artificial, or not an artificial, an alternative sweetener in a drink, I would prefer stevia. That's what I'm going to choose, because it's still more than you want. It's still more than you want. Is it going to cause the things that they're showing up in these studies? I don't know. You know, where does that line draw? But I choose stevia if I'm going to use an alternative sweetener, or honey. I like honey. I had a root canal while living in New Zealand for a few months, which I resisted, but I had a major infection, which the dentist told me I needed to do a root canal. What should I do with it now? So you need to go get a cone beam CT scan, and you need to see what is the status of that tooth. If that tooth is reinfected, then I recommend you remove it and you replace it. If it's not, then you decide. What systemic issues do I have? Go check out what's called the tooth meridian chart, which basically it tells you which systems may be affected by which tooth. Just Google it, tooth meridian chart, and see if that tooth, look and see what it is. If it's a molar, it's usually stomach, large intestine, lung. If it's further forward, this is breast area. This is gallbladder, kidney, liver, all the way kind of moving through the front area, urinary tract area here, way in the back. This is hormones. So you go and see, that's crazy. I've had liver issues, and here's my root canal right here. Yeah, it's probably related. Then you decide, do I want to leave that in, or do I want to get it out? Does drinking A2 milk help with gut health? So what that milk is going to do is it's simply going to be less allergy inducing. So if you don't have an allergy, then it's not going to be a problem. It's still pasteurized. So there's still issues with the way that the minerals are absorbed in that milk. It's just got a different, basically, protein profile than the typical milk that you're going to drink. So could it help with gut health? Perhaps, I suppose, if it's a gut lining issue and a sensitivity issue, then yes. If it's just you're not absorbing properly, then no, because this is not going to really give you any more minerals than the other kind of milk is, because it's all pasteurized. Some biodentists say that implants also cause major health issues like root canals. They would get infected because there's no longer a periodontal ligament. What do you think about that? I don't agree, because the infection that we see on a dental implant is not the same as a root canal. A root canal is because there's dead tissue in the body still. It's a dead organ that we've just left in the body. An implant is not that. An implant is simply something that's opposed to the bone. It's surrounded by bone. And if we see an infection around a dental implant, we see it at the very top. We don't see it at the bottom. So when you're chewing on it, it's not going to be an issue the same way as a root canal is. A root canal reinfects at the bottom. A dental implant reinfects at the top down. So we see it very quickly if there's an issue. There's no dead tissue. So there's nothing that the bacteria are attracted to. That's what the bacteria are attracted to in a root canal is the dead stuff. There's no dead tissue in a dental implant. So we see the infection if it happens quite quickly. And it's interesting, dental infections on dental implants look very different than teeth do. So we see it very quickly if it's going to happen. It's it's not common. And I don't see health issues if you're using ceramic. If you're using titanium now, we have a different story. Because now that titanium is going to basically short the system with what I just talked about, that dental meridian system. It's going to short the system with whatever's connected to that tooth. Ceramic implant is non-conductive, so it's not going to short the system the same way. So that's why we recommend ceramic over titanium. Okay, micro versus nano. I'm guessing what you mean by that is hydroxyapatite. Let's talk about that. So the key with hydroxyapatite is, well, first of all, we have to talk about teeth, the structure of tooth. Enamel structure is crystalline, and there's some voids, or there, if you think back to what a crystal structure is, there's like a thing and then some space and then a thing and then some space and then a thing, and they are all connected together like this. Well, that space can allow things in, and it also can allow things out to be pulled out. And that's what happens when a tooth demineralizes or starts to have a cavity or less strength, less minerals, is minerals are pulled and they leave holes behind. Well, if we want to remineralize, we want to put a mineral into that hole. Well, these holes are tiny, okay? So a dentinal tubule, or the tubes that go out through the tooth, and these little spaces in the enamel, they're really, really little. We need a small enough particle that it's going to actually be able to go in and plug it. Because if it's a great big particle and the hole's super teeny tiny, well, it's never going to get in and it's never going to fix the problem. So it has to be small enough to get into the hole. However, too small, nano, they've found, will cross the blood-brain barrier. And so now you're going to get nanoparticles in the brain. There is a little bit of caveat I'm going to tell you on this one, though. So let's just go with this for a minute, and then I'll tell you the other piece. So we want something small enough that it'll get into the tooth, not too small to get into the brain. That's why we choose micro. So it's all about definition, and I'll be super straight, and I'm really transparent about this. My particles are 200 nanometers. So you might say that's nano. Say, no, it's actually not. Nano is defined as 100 nanometers or smaller. So what they tested when they said a nanoparticle is 100 nanometers or smaller. I'm using a 200 nanometer particle. Why? Because it's not small enough to get into the brain, but it's small enough that 8 of them could fit into one dentinal tubule. I want to be able to plug it efficiently. So absolutely micro, but it needs to be still small enough that it's going to fit into that tubule. Here's the caveat. When you're using it in an oral care product, so they're talking about cosmetic products. The big study that was the big hubbub about this nano piece was in cosmetic applications. Well, this is an oral application. We're actually putting it in our mouth, and we're spitting out the large majority of it, but we know some's going to get in no matter what. You're going to get some hydroxyapatite in. It's going to get into the gut. Here's the cool thing. When hydroxyapatite hits your gut, it actually dissolves into its constituent minerals. So calcium, phosphorus, magnesium, it just dissolves into that. So even if the particle size that we're using gets beyond the mouth, you swallow it, gets into the gut, it's going to be broken apart into minerals. You don't have to worry about it. You don't have to worry about it. It's not going to your brain. All right. I am really past time. Man, there were such good questions on here today. Such good questions on here today. I'm going to be doing this on Tuesday again next week. And you know what? I believe my team member is on here. Kathleen, if you will give me some of these, I'm just going to record some video. I'm going to record some stories just answering a bunch of these questions because these are fabulous questions. Let's just do some question answering, and I'll do it on stories, and I'll throw it out there, and I'll see if I can't get caught up on the questions that you had today, and then I'll tackle again next week. And then I'm going to be offline for a couple of weeks. If you follow me online, you'll see why. You'll see where I am. But I won't be doing a live for a few weeks after that, but next week I will. But let's just see if we can't knock out some of these, Kathleen. I'm happy to, if she'll send them to me, I'm happy to do some stories to answer some of these questions. Such good questions. I love it. It means you're paying attention, you're listening, you're asking questions, which you need to do. You're worried about your health and you want to find the right answers. And thank you so much for being here so I can help share some of what I know and hopefully get some of these questions answered for you. Have a fabulous week, you all. And we'll see you next week, Tuesday at 11 a.m. again.